For some tests we can do to rule in bicipital tendinitis, first we want to do Speed's test. So we're just going to have them with their arm out, and we're going to resist them as they extend up. And then if that causes any pain through there, that could indicate a positive test. We can also do Yergeson's, so we're going to have them cross their arm over, and we're going to have them resist by pushing out again. Push, 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 all the way to full extension through there, resisting the whole time. Again, if they have pain with that, that could indicate some bicipital tendon issues. So a couple of tests we can do to rule out the pathology is, first we're going to do an empty can test. So I'm just going to have you bring your arm out, both of them, and then turn your hands over like you're pouring out a can, and then we're just going to push on it there. If this was a positive test, there could be some kind of pain around there. This indicates an impingement. And we really want to check this one because the biceps, the long head of the biceps tendon runs through that subacromial space as long as supraspinatus, and this test tests that muscle. So if this bothers them, this could indicate more of an impingement type of issue rather than a tendinitis. So just to rule out impingement again, we can also do a Hawkins-Kennedy. So we're just going to bend and kind of work in different planes. Again, if this bothers them, that could indicate an impingement rather than a tendinitis. So we just want to check that, rule that out. We also want to rule out some rotator cuff issues because those muscles, again, affect that. So we're just going to do a quick drop arm. So we're just going to have you raise your arms over your head and then slowly lower it down. And so if they can do this, no problem, then that's good. If they had kind of a drop through there, then that would indicate maybe a rotator cuff issue. We can also do a labral test just to check the integrity of that real quick. So I'm just gonna have them sit. And there's different levels of clunk, grind, and the other one, but we're just gonna have, here you can also have them supine, but we're just gonna load the joint. This is a grind, and then kind of move that humeral head around. And if there's pain or clicking with that, that could be more of a labral issue. So we just want to do all those, and if all of them are negative, that would be good, and that could help us rule in or out our pathology of a bicipital tendinitis. So for early rehab, we want to just have them come in about 3 days per week, and our main goal is to just decrease the inflammation, early activation of the muscles, but we don't want to push it right now. So what we really want to focus on is actually engaging and turning on the posterior chain. So rather than our actual bicep, we want to do rhomboids, lats, traps, all that stuff. So the first exercise is we're going to have them grab the bands and just pull right down to their sides and engaging those rhomboids. So trying to pinch between there and then again, and just nice pull backwards. And then we can also, to do more upper middle trap, is to pull to the chest. Yep. So right through there. Again, we don't want their elbows to be dropping. We want them nice and even on the side, pinching their shoulder blades in the back. The next thing we can do is we're going to get a band, a green band, and we can put it around their wrists. And again, we're going to do rhomboid activation. So we're going to go against a wall. We want it to be 90-90 with their elbows. We want them to relax their upper traps, but engage the rhomboids. So try to pinch my fingers. Good. And then relax there. And then just to move in and out. So a simple thing, but really making sure they're staying engaged here and relaxed here. Good. And then last thing I want them to do is just a wall slide. So this is to keep working that range of motion. So just hands up and then push up as far as you can and down. Good. Making sure their core stays tight. We don't want any archy backs causing a different issue, and just that for now. So after a little bit of time with those early exercises, whenever we can get the biceps tendon to just calm down, we could start with more intermediate. So now we want to target more strengthening. We still want to include that posterior chain activation. So after they do their main strengthening exercises, if we have time to do something like along those lines, those rhomboids or the lat pull downs. But now we want to focus on strength. So the first exercise is kind of a biceps four-way in a way. It's all of the motions that the biceps does. And so first we're going to kind of curl it up, go down. We're going to lift straight arm up and down, curl in, and then back around. So that is strengthening the whole biceps, both heads, and just early strengthening on. We have a lightweight right now, and we can progress to a heavier weight eventually. Next, we also want to start doing eccentric strengthening. So what we're going to do is have them start up. I'm going to hand them the weight, and then they're just going to curl down nice and slow, getting that lengthening of the muscle. And then we're not going to have them curl back up. We're just going to re-pick it back up for them and then come back down. And good. So last thing we want to target, could you lay on the ground? We'll just use your hand. Is we want to do some rhythmic stabilization. We're getting more of that proprioception and that reaction time back again. So we're just going to have them, they would hold a ball, and we're just going to hit and have them try to keep their fist there the whole time. We want to make sure they have time to react, so we're not going quickly. We just want to do a nice push and then bring it back. Okay, so for more of our advanced exercises, we're going to have them do a push-up, just full weight bearing, making them, activating all those arm muscles, the core, a little bit of that, seeing if that bothers them at all. Good. We're also going to set up kind of a band, and due to their position on the boat, they're going to have some rotation. So when they pull back, we're going to wrap it around an object, and then they're going to pull in and then come back out. So that arm right here is the one that's twisting, the one that's irritated. So we're really just training that motion again for kind of later in the rehab before we clear them. And then for a more like plyometric exercise, they do this in the boat, but for right now we don't have a boat. These are called stroke taps. And so when they do their stroke, they come up and they do a little catch and a little like flick of their wrist. So they're training that biceps, and they're also getting some of that quick twitch back again. And also we want to make sure they're still training cardiovascularly. So if they can bike or run or anything without rowing, that is good to get them their heart rate back, and also encouraging strengthening and range of motion as well. So stretching and still strengthening the biceps and that posterior chain. So for their clearance, we're going to want to make sure that their strength is back. So we're just going to want to do a manual muscle test. So take that, and we're assuming the tendinitis is probably up here. It's probably not as distal, but we want to test that long head. So they're just going to push up into us, and we're going to resist. Good. And hopefully that doesn't give them any pain, but their strength is good. If we still feel some weakness, we might not be ready. And then we can also do those tests that we did earlier, the speeds and the Yergesons, just to see if there's any pain with those still. If there isn't, then that's a good sign. You might be ready. Another big thing that we're going to want to make sure they can do before they get back to sport is pick up the boat. That is a big part of their sport, so we're going to have them, this is a boat in our case, and we're just going to have them practice picking it up, and if there is any pain with that, then they are not ready. But if they can do it, maybe it just is a little weak right now, then that's okay. And so our final clearance exercise is just putting them on a row machine and having them row for 5 to 10 minutes. That's probably longer than what their warm-ups would be, but just making sure they have that endurance, checking their form. It's not exactly similar to what they would be in the boat, especially in the stroke seat, but this is kind of a similar thing we can do before getting them back on the water, and just watching their form and seeing if there's any irritation within that biceps.